a great holiday season and are back in the groove of things. And we're trying to do the same with continuing on with our meetings. So hopefully everyone has had an opportunity to look over the agenda and the minutes from the last meeting. If there are no, well, we do have one amendment to the agenda, which I think is to add the Black Youth in Crisis resolution to our new business section.
That's correct, Mr. Chair.
Yeah. So I don't think I can move for that amendment or that amendment to the agenda. But if someone else does, we can put it to a vote. And any other changes to the agenda, feel free to speak your piece at this point.
I move to add that item to the agenda.
Okay, very good. All right, so it's been moved and properly seconded. Do we have any debate about the modifications to the agenda? All right, I think we're ready for the question. Rosalind?
Dr. McDougall?
Yes.
Dr. Ray?
Yes.
Commissioner Alum? Dr. Jackson?
Yes.
Dr. Braithwaite?
Yes.
Dr. Orto?
Yes.
Mr. Brown?
Yes.
Mr. Gregorio?
Yes.
And Dr. Glover?
Yes.
Thank you.
Awesome, thank you. So we're going to move on to our committee reports, which is a little earlier in our agenda. We have a report coming from our nominating committee with the recommendation for leadership of the board for this year, 2024. So at this time, I'll give way to Dr. Rosemary Jackson to present her report and recommendations.
Okay. Well, thank you so much. But I did try very hard to talk Rosalind out of putting me first. But here I am. So the nominating committee consisted of myself as chair, Dr. Jim Miller, and Mr. Gregorio. I think he's on, right? Okay.
Yes.
We met this week via telephone to come up with our slate of new officers for this year. So I spoke with both Dr. McDougall and Dr. Ray regarding their interest and ability to continue as chair, Dr. McDougall, and Dr. Ray as vice chair. And yay, they both agreed to continue. So I'm presenting our slate of officers for this year. Dr. Roger McDougall, chair, and Dr. Jean Ray, vice chair. And I think, Rosalind, do we need to see if there are any other nominations from the floor?
Yes, ma'am.
Okay. So are there any nominations from the floor? Okay. So if not, we'll proceed with a vote on the said slate of Dr. McDougall as chair, and again, Dr. Ray as vice chair.
Dr. Jackson, do we have to make a motion to accept the recommendation?
The report? Okay.
Yeah.
Yeah.
I move to accept the recommendation of the nominating committee to elect or to vote for Dr. McDougall as chair and Dr. Ray as vice chair of the Board of Health. Second.
All right, folks, it's been moved and properly seconded. Are we, is there any debate? All right,
Do
we're
you
ready.
guys accept?
I accept, yes.
Dr. Ray?
I accept also, yes.
Okay, thank you.
Do we need to vote?
Yes, sir. Yes,
Okay,
sir.
very good. Okay.
Dr. Jackson?
Yes.
Dr. Braithwaite?
Yes.
Dr. Orto?
Yes.
Mr. Brown? Mr. Gregorio?
Yes.
And Dr. Glover?
Yes.
Thank you.
All right.
Yay.
Well, thank you, folks. Thank you.
Thank
I
you both.
appreciate the confidence that you have in the both of us. So we will continue to do our best to serve this board and this community. So thank you again. with the other other three committees, there's really no report, but I have I sent out earlier this week, or I think it was last night, I sent out my recommendations, at least for the committee appointments for both for the personnel, the finance, and the operating procedures review committee. So I'll go ahead and read at least the recommendations, and we're going to have to make some modifications here, but we'll deal with that in just a little bit. So with the Personnel Committee, Dr. Jean Ray will serve as our chair. Mr. Joshua Brown will sit on that committee along with Dr. Daryl Glover. I also have Dr. Mary Braithwaite on that committee, but Dr. Braithwaite will be coming off of the board, sadly, but we certainly appreciate her reasons for moving on, and certainly want to thank her for her many years of service to this body. So thank you, Dr. Braithwaite. So at this moment, with Dr. Braithwaite coming off of the board after this meeting, we will have those three members, Dr. Ray, Mr. Brown, and Dr. Glover. My hope is to fill the engineer position, and we are certainly going to fill the physician position as well, and then move those folks, our new members, onto these committees. But if there's anyone who would be so kind as to volunteer to serve as the fourth member of the Personnel Committee until we find a suitable replacement for you, I would certainly accept that willingness to step in and fill that space. I don't think the personnel. Go ahead.
Yeah, no, I'm sorry. Dr. McDougall, I'm on, or I guess Roz, I'm on as a community member, right? Which do you all
Yes.
think would be more difficult to fill, the physician or community member? Because I would be interested in being the physician with Mary leaving. But if it's easier to get another physician than a community member, then it doesn't matter to me. So I just put that out there.
It's up to Dr. McDougall to
Okay.
whatever he chooses to do.
So Dr. Braithwaite was kind enough
But
to.
you know what? I take that back. The thing is, I rotate off next year, I think.
Next year.
So I would only be in it for 1 year. So take that back.
Okay. All right.
Yeah.
So Dr. Braithwaite, I'll let the board know. Dr. Braithwaite has made a recommendation for the physician seat on the board. Dr. LaRon Jackson, who is an MD, MPH, and she's the medical director for UNC Urgent Care. Is that correct, Dr. Braithwaite? So certainly qualified. So at this point, I think the next steps for us will be to review her application once it's been made. And I think the process is fairly quick hopefully as far as approving her to that position once we receive the application. Am I correct with that, Rosalind?
Yes, sir. I will reach out to her to provide her with the steps on doing the application for the board.
Okay. And I know our engineer seat has been vacant for over a year,
Yes,
maybe
sir.
2 years. Been a while, and it's been advertised the whole time. I've reached out to someone who I know who is. I'm not confident. I'm not 100% sure that person is a professional engineer, has a license in North Carolina, but I feel very confident that he will be able to, if he's not or not interested, that he will be able to provide someone that can fill that seat. So hopefully we're going to have those two seats filled hopefully before the February meeting, but certainly before March is my hope. So if anyone is willing to step in and serve double duty and serve on the personnel committee, until we get a replacement for Dr. Braithwaite, or Dr. Braithwaite's replacement can take that seat. I would certainly. I don't even think the personnel committee has anything to do before that happens. But if anyone's willing to serve, not all at once. So I think we can, Rosalind or Director Jenkins, would we be able to have only 3 members on the personnel committee for a temporary period of time? Will we be out?
About not with your operating procedures. Your operating
Okay,
procedure says a chair and 3 members.
Okay.
So we need to stick with that.
All right, folks.
Hey, Dr. Wolf, I'm happy to volunteer for that.
Thank you, Anthony.
Who was that?
So that's Anthony
Anthony.
Gregorio.
Okay.
He's gonna serve as an interim member of the personnel committee, unless you want to switch some of your assignments. But thank you, Mr. Gregorio. All right. And so with the finance committee, the budget and finance committee, again, Dr. Ray will serve as our chair, being the vice chair of the board. We also have, once again, Mr. Anthony Gregorio, Dr. Rosemary Jackson, and Mr. Joshua Brown, rounding out that budget and finance committee. With our operating procedures review committee, Dr. Vicky Orto is serving as our chair. Dr. James Miller and Commissioner Nita Alam are finishing up that committee. And then if you've already heard from our nominating committee. So we have committee assignments at this point, and we will continue to be vigilant as far as getting all of our seats filled so that we're not overworking any of you good folks with too many committee assignments. But thank you so much for your willingness to serve on these committees. I really appreciate it. All right, so we've already approved the agenda. So let's, I will entertain a motion to accept the minutes from the last meeting. Again, we've hopefully had an opportunity to look over those. If there are no additions or corrections, I'll accept the motion for approval.
Motion to accept the minutes.
Second.
All right, it's been moved and properly seconded. If there's no unreadiness, we are ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Jackson,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Glover.
Yes.
Thank you.
Awesome. The next thing on our agenda is public comments. Ms. McLean, do we have any public comments registered for this evening?
No, sir.
No, very good. All right, so our next item is staff and program recognition. So I will once again give the floor to Director Jenkins for those items.
Thank you, Mr. Chair. And again, Happy New Year to this illustrious board. I hope you enjoyed your holidays, and I promise to be very brief. But I definitely want to give kudos and lift up our finance administrator, Ms. Micah Gwendon. It has been 1 year since I introduced her to this board, and she has been nothing less than stellar. She has been received very, very warmly by not only the public health enterprise, but the county as a whole. As you well know, we are in the throes of budget season, and I'm pretty sure that any accolades that I can give her will go a long, long way. But just want to recognize her for all of her hard work and her dedication, and thank her for being a part of our team. That is all I have, Mr. Chair.
All right, thank you. And I'll echo those sentiments of thanks and congratulations to Micah Gwendon for her excellent work with the department. So we have, this is going to be a quick meeting, I think. Our administrative reports and presentations. We have our public health vacancy report. which again looks to be fairly standard. I know the department is working hard to fill those vacancies, but Director Jenkins, do you want to make any comments?
But the fear sounded like a broken record. I'll just say we are continuing to fight the good fight and do very well with filling our vacancies, especially now, knowing that going into next budget year is going to be a pause on new spending and new initiatives and everything. So again, giving kudos to the leadership team for working hard to fill those vacant positions to ensure that no positions are taken away from us. That is all, Mr. Chair.
All right, very good, very good. The next item on the agenda is our public health NOV report for January of 24. Mr. Jenks or anyone else that might want to?
We do have Environmental Health Director Chris Salter, who may be able to speak on any changes to the NOV report. Chris?
Yes, we had traditionally December is a very quiet month for on-site anyway, but we only had 2 changes. We were able to get a permit issued by the city for connection line 15. I believe it's 7309 Farrington Road. That's always good when we can get someone off an on-site system and onto sewer. And the only compliant change that we had someone added to the compliant list. That's 1418 Mockingbird Lane. We had a septic tank that was actually found open during a visit, and that is just for y'all's information. Sewage on the ground is not considered an imminent hazard, but an open tank like that is, because a child could easily fall into it and drown or suffocate. And so that has to be addressed quickly. And we were able to get that properly abandoned. So that is in compliance now.
That's the Mockingbird Lane.
Yes,
the
sir.
Damage. It's okay. Very good. Thank you. Thank you.
Welcome.
And my apologies to Dr. Jenks. I was going to put you on the spot with something that you probably don't have a lot of knowledge about. So my apologies, Dr. Jenks. So moving forward, well, let me first ask if anyone else has any questions about the NOV report or comments. All right, moving forward, then we have our health director's report. Dr. Jenkins, I'll give you the floor once again.
Thank you, Mr. Chair. And again, not much to, well, always a lot, but certainly want to lift up a couple of things. Again, you have a report of our strategic plan, which is continuing to progress rather nicely. But more attention I'd like to give to our dental program, which they're treating pregnant women in the dental clinic. I think that's something noteworthy, and it's certainly admirable, because statistics show that, during pregnancy, women tend to forsake their dental care. So again, our dental operatory is doing a fantastic job on that. And, we always have a very nice report from our nutrition division. They continue to do stellar work, but I definitely wanted to lift up the dental in their work with pregnant patients.
Thank you. I appreciate that. And I had I guess a question about that in the report. One of the challenges was that that the treatment and the checks, the hygiene checks, I'm assuming, can only be provided by the director of dental practice because she's the only general dentist on staff. Is there any consideration for maybe a partnership with UNC? With the pediatric or the hospital dental residencies that might be able to come in and provide some services?
We do have a stellar partnership with the Adams School of Dentistry at UNC. I'm definitely going to defer to Jim Harris, who is on the line, who can speak a little bit more to answer your questions more definitively. I do know that we do have some trials and tribulations as it involves having residents and representatives in the clinic at times, but we tend to work things out when things bottleneck at times. But I'm not exactly sure if Jim is available to speak, but I do see him on the line. Or I will defer to Liz Stevens, who may be able to provide a little bit more insight. Oh, Jim.
Yep. So thanks, Rod. Good evening, everyone. So yeah, our contract with the Adams School of Dentistry, those are pediatric dentists, residents, and students. So I guess it's something we could explore. I mean, everything could be talked out with them, but it hasn't really come up yet between our dentists as well as the hygienists who can do some of the work, and then the dentist just does the checks. We're good right now. If we wanted to expand it, it is something we would have to consider because Dr. Jagadisan can only see so many patients. And again, these are referrals from our women's clinic and public health. So I don't think we're overwhelmed. However, if we wanted to expand further, that would be something we could look at.
Okay. Yeah, just a thought. So I appreciate that. Thank you, Dr. Harris.
Thank you.
All right. I think that's all. That's the only question I had, or I guess maybe even comment. Does anyone else have any questions or comments regarding the director's report? All right. Commissioner Alam, go ahead.
Yeah, thank you. Sorry for joining late. I just had a
No, you're
quick,
fine.
sorry, crying baby in the background. Follow up on that conversation around the UNC. I know that, and Dr. Harris may know more about this, the UNC School of Dentistry also has the Dior Clinic, which was formed after the Chapel Hill shooting. They created a clinic in honor of Dia and Yusur, Dia, who was a current student, Yusur, who was about to be a future student, where they do service projects. And especially with the upcoming anniversary of their passing, they increase the amount of service projects they do in the community. That may be actually a good partnership and relationship because it's solely dedicated to getting the students to do acts of service around the community.
Yeah, absolutely.
Thank you for that recommendation, Madam Chair, and that's certainly something that we will endeavor to look into in short order.
Very good. Thank you. Any other comments or questions regarding the director's report? All right. Well, at this point, I don't see any items under old business, so we're going to move to new business. And again, we have added the Black Youth in Crisis resolution. So at this time, I'm going to give way to Vice Chair Ray for the reading of the resolution.
Yeah, hi everyone. Happy to read this out to the group. It is rather lengthy, so just bear with me as we work through it. It's titled the Black Youth in Crisis document. And it starts as, whereas mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. And whereas nationally in 2020, emergency visits due to attempted suicides among adolescents jumped 31% from 2019 to 2020. In addition, among adolescent girls, emergency room visits for attempted suicide increased 51% from 2019 to 2020. And whereas in 2021, out of the students that attempted suicide, 47.5% of middle school students and 41% of high school students surveyed in the Durham report were Black. And whereas ACE exposure is correlated to higher rates of smoking, drug use, heavy alcohol use, poor educational and employment outcomes, incarceration, and involvement in violence, both as a perpetrator and a victim. And whereas opioid overdose ED visits were disproportionately higher amongst Black residents of Durham County than white non-Hispanic residents. And whereas gang-involved individuals surveyed in Durham reported ACEs, a family member going to prison, 72%, 70.5%, loss of a parent, 70%, exposure to verbal abuse, 57.5%, reported exposure to parental physical abuse, 47.5%, living with substance abuser, 62.5%, and though least likely to report sexual abuse or assault, 17.5%, were exposed to sexual abuse or assault before age 18. And whereas having a sense of belonging and connection with a larger group who has got your back, e.g., school, church, clubs, neighborhood, etc., are childhood experiences that can result in positive outcomes for youth. And therefore, be it resolved that we, members of the Durham community, do hereby commit to working alongside young people in Durham to uplift their mental health needs, address adverse experiences, stigma, and help remove barriers to care. Therefore, be it resolved to use a screening, brief intervention, referral to treatment model to quickly assess and address trauma and substance use in schools and in the community through a co-developed MH/SU professional consortium. Therefore, be it resolved, resources should be provided by organizations, including community-based organizations that are free or charitable. They should also be created with consideration of an understanding of ACEs and diverse cultures and backgrounds. Therefore, be it resolved that a co-created resilient community campaign with community and institutions be launched to promote well-being and address individual, interpersonal, community adverse experiences and trauma that may lead to substance use, violence, and harmful outcomes. Therefore, be it resolved that everyone can play a role to increase resilience and prevention by acting on one or more of the 7 strategies for community change. Therefore, be it resolved that we will commit to supporting community-based, culturally relevant mental health / substance abuse prevention and well-being programs in schools and within the community for young people and their families in Durham.
Thank you, Dr. Ray, for that presentation. I will at this time entertain a motion for us to accept the resolution and forward it to the Durham County Board of County Commissioners, headed by our very own Commissioner Alam. Chair Commissioner Alam.
I'd like to make a motion to forward this along to the Board of County Commissioners.
Second.
All right, it has been moved and properly seconded. Do we have any unreadiness? All right, we're ready for the vote. Ms. McLean? Still on there?
Excuse me, I'm on mute.
There she is. Okay,
I
no.
apologize. Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Braithwaite,
Yes.
Dr. Miller,
Yes.
Dr. Orto,
Yes.
Mr. Brown, Mr. Gregorio,
Yes.
and Dr. Glover.
Yes.
Thank you.
Thank you. So moving on, we have the next item on our agenda are our budget amendments. We have 2 together totaling over $330,000. So I will give the floor to our director for presentation of these amendments.
Thank you again, Mr. Chair. First, for your consideration, the board is requested to approve a 3% consumer price index increase in the amount of $112,833 to the current contract that the county has with WellPath to provide comprehensive medical services for inmates in the Durham County Detention Center and also residents of the Durham County Youth Home as referenced by RFP 21-030, comprehensive health care services for the Durham County Detention Facility and Durham County Youth Home. The total amount of the year 1 current contract will be $5,014,000 $1,267.33. The second is actually monies coming in, and that is the board is requested to approve a budget ordinance to recognize funds in the amount of $222,559 from the North Carolina Department of Health and Human Services Division of Public Health, Epidemiology, and Immunization Branch. These funds given to local health departments are to help support activities associated with the Bridge Access Program for COVID-19 vaccines and treatments. As you may recall, this program funding helps to maintain access to COVID-19 vaccines for those who are uninsured and underinsured, who are adults through existing public health infrastructure or HRSA-supported health centers and participating pharmacies. That is it, Mr. Chair.
Okay, thank you. So we have heard the amendments. Do we have a motion to, or do we have any questions first? And if not, I'll entertain a motion to accept those amendments.
Motion to accept.
Second.
Again, it's been moved and properly seconded. If there's no unreadiness, we're ready for the vote.
Dr. McDougall,
Yes.
Dr. Wright,
Yes.
Commissioner Long,
Yes.
Dr. Jackson,
Yes.
Dr. Brightway,
Yes.
Dr. Miller,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Glover.
Yes.
Thank you.
Okay. Do we have any agenda items that we would like to see on our February agenda?
Dr. McDougall, not an agenda item necessarily. This may be just a question for Dr. Jenks that came up
Yes.
recently. I was just interested. So now that the majority of the government supply of the COVID treatment or therapeutic called Paxlovid, it has essentially has gone away and it's commercial supply. I didn't know what alternatives the department had for patients that may qualify for treatment, and if there are a mechanism for assistance programs or what we're doing to help patients that may qualify.
Yeah, that's a good question. I'm not sure because we haven't really been prescribing any of these COVID treatments at the public health department. I mean, Paxlovid still, as far as I know, is the mainstay, treatment. The monoclonal antibodies, have fallen out of favor because they stopped working, and some of the other oral agents don't work as well as Paxlovid. So as far as I know, that's still the go-to drug, and like providers in the community are still prescribing it. I believe that there is some mechanism through the state health department to get that if needed. And we've done that. There is a way to get treatment for Mpox through the state health department too. So I think that is a mechanism. We've just not used it, but I think providers in the community could if they needed to. There is just going to be a delay. The other thing that I believe this clinical trial is still open is oh no, that was for Mpox. There's a Mpox clinical trial that folks are being ferried to or funneled to. So I think there is a mechanism through the state, but it's probably going to be a little less efficient than just going to a pharmacy. I hope that answers your question.
It does, yeah. I wasn't sure how many patients that were presenting that you may prescribe, but it sounds like it's very minimal. So
it's zero, yeah. Because if someone's got symptoms of COVID, we generally don't want them to come to the health department and expose other people. Yeah.
Great. Thank you very much.
Yep.
Chair Alam, you had a question?
Not a question, just a request for next meeting, because obviously we won't have it at this meeting, but VP Harris was in Charlotte today and announced that $285 million for mental health resources in schools. And I think they're saying that 12 million of that will come to North Carolina. So if at our just next meeting, getting an update about like how much we think we'll be able to get in Durham, if there's going to be an application process, or just how we can support and help that, as much of it coming to Durham for our schools.
Sure. Thank you.
Chair Long, while we're not necessarily in the mental health, behavioral health space. I'm happy to get that information for you. I do know to this board and yourself, just to announce that Secretary Cody Kinsley has begun to inquire as to how public health may assist in the behavioral health space. So with that, as an officer of the Association of Local Health Directors, this is something I've been privy to, information I've been privy to. We do have some ideas, and we are gearing up to present those ideas in hopes of having it in the governor's budget in an effort to petition for more funds for public health to do this work in the short session. So again, happy to research that and get that for you, Madam Chair.
Thank you.
Thank you. Any other topics that or items that we would like to discuss at the next meeting? Okay, well, we'll leave the rest to Director Jenkins and his staff. I guess the floor is open for informal discussion at this time. Anyone wants to make any comments? Once again, I want to thank Dr. Braithwaite for her many years. I'm not sure, is it 15, 12, 9?
It's been
I
9
believe-
years,
9 years of service.
3 terms.
3 terms. All right. Well, thank you again, and the best to you as you move on into other spaces and roles.
Thank you.
Thank you so
I've
much.
enjoyed being a part of the board. Thank you guys for having me.
Mr.
Yeah.
Chair,
And I'd like to say, when I was chair, Dr. Braithwaite was chair of personnel committee and was very, very helpful in our role at that time into personnel issues. And she was just great,
Awesome.
great to work with. And also in the COVID space, the work that she had done in the COVID space was phenomenal. So thank you so much. We will definitely miss you.
that certainly is something I was going to speak on, her work in the COVID space and actually having 10 toes on the ground, doing a lot of vaccinations, hours-long vaccinations, a lot of drive-through vaccinations. She is a public health hero.
Thank you. And we're still at it. Not done.
Absolutely. Thank you again. Any other discussion before we move for adjournment? All right. Seeing no other points, I will entertain a motion for adjournment.
Great meeting, Dr. McDougall. 38 minutes.
Motion to
moved.
adjourn. Second.
All right. Let's see. Liz was saying something in the chat. Oh, she's thanking Dr. Braithwaite as well. So
Who?
for the work that was done in the COVID space. So we're all appreciative of all of your hard work, and we know we're not done seeing you, Dr.
Oh, no.
Braithwaite.
I'm still here. Thank
right.
you guys. Thank you, Liz.
All right, so it's been moved and properly seconded for our adjournment. We're ready for the
Who made
question.
the motion? Who made the motion to adjourn?
Vicky Ordo.
Okay, thank you. All right. Dr. McDougall,
Yes.
Dr. Wright,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Braithwaite,
Yes.
Dr. Miller,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
Dr. Glover.
Yes.
Thank you.
All right, folks. Thank you. That was a quick one. I
Yeah.
don't know how many more we'll have like